Any teaching hospital faces substantially more challenges than other healthcare organizations that do not allow medical students to practice their clinical competencies as part of their schooling, let alone during a pandemic. Now add this factor to that equation. The same HCO serves a demographic group that is partially immigrant and poor working class minorities. With an unpredictable and unprecedented influx of patients, shortages of personal protective equipment, ventilators, medical staff, and hospital beds, it is not difficult to understand how in early spring of 2020, the public city's Elmhurst Hospital in Queens, New York, felt overrun as it was the most overloaded and hardest hit hospital in the city. Elmhurst, already one of the busiest hospitals in the city, this pandemic blindsided the facility, causing high levels of stress and desperation to all staff hospital wide, but especially to the staff on the front lines. A newly assigned CEO has moral, ethical, and professional duties to fulfill for the health and welfare of all patients and staff. This presentation will provide a blueprint of the steps necessary to achieve success in the realm of culture and ethics, and in the realm of managing internal and external constituent groups within the healthcare organization, with the purpose of steering the organization in the right direction during these turbulent times and even after the storm calms down.
Hello everyone, I'm Clint-Clint. This portion of the presentation will go over factors affecting the culture at Elmhurst Hospital and the steps needed to take in order to achieve success moving forward. As a brief overview, I will discuss pre-existing issues and concerns, leadership challenges, and pathways to achieve success. Pre-existing issues and concerns. These are basically the issues leading to the hospital's ability to respond to the outbreak and an identification of factors that contributed to the current culture at the hospital. The main patient population is poor, working class minority residents who are at a disproportionately higher risk of contracting COVID-19, which in turn doubled the normal daily workload at the hospital. There was also limited ICU space identified early, yet there was no collaboration or plan with other hospitals to divert patients prior to the start of the pandemic. It had been established that there was a major shortage of PPE and other needed life-saving equipment. However, the federal reassurances did not deliver provisions as promised. Also, the disease was too unpredictable, as so little was known on how to properly care for infected patients, as well as protect healthcare staff and their families from contamination. Leadership challenges. These are the issues the CEO must address and the mindset of the staff because of the pandemic. The staff is overworked and on the verge of burnout due to the increased patient workload. Although adaptive steps were implemented to deal with the ever-changing dynamic environment and the increased workload, staff feel it is not enough. Feelings of frustration due to no support, the loss of life, and leaders not listening left them with the attitude of too little, too late. The perception of broken promises led to loss of trust, and now the staff fears the unknown and how they will get through the next wave. Pathways to achieve success. These are the specific steps needed to meet the challenges in the aftermath of the COVID-19 pandemic and how the CEO will maintain a transformational culture committed to safety. The CEO must influence the governing board to get back to the basics by focusing on 4 of the 6 functions of cultural leadership. First, promoting shared values will lead to a celebration of the exceptional efforts of staff during the crisis. Second, empowering associates by facilitating that they work on performance improvement teams to develop better healthcare strategies based on lessons learned during the pandemic. Third, communicating with associates will be accomplished through increased rounding. This will let the staff know that the leaders are present and fully engaged in addressing their concerns. And finally, supporting service excellence by formally recognizing staff with rewards. This will demonstrate how valuable the staff are and that their hard work and sacrifices did not go unnoticed. An example would be paid vacations for all the staff directly involved in some aspect of managing the pandemic related to patient care. Just to recap, I discussed in detail pre-existing issues and concerns, leadership challenges, and pathways to achieve success regarding the culture at Elmhurst Hospital. I will be followed by Paula Hosier, who will go over ethics at Elmhurst Hospital.
Hello, my name is Paula Hosier, and I will be presenting to you the ethical concerns we face during our response to COVID-19. The topics of discussion will include the uncertainty faced by staff, leadership, and patients, steps needed to safeguard, protect, and support these individuals, as well as planning for various levels of care while maintaining dignity and respect for our patients. Our primary concerns when addressing our response center around the need to evaluate and modify operations to changing conditions, new requirements, limited resources, reactions to shifting ethical demands and anxieties amid staff as they care for patients. In addition to the uncertainty faced by the staff, leadership, and patients, we must define the steps that need to be taken to safeguard, protect, and support all concerned, as well as plan for the various levels of care that will be required. We will manage uncertainty by addressing staffing levels and safe practices. To care for our patients, we must ensure that adequate staffing levels are maintained and that the staff have the proper training and skill set to care for patients with such serious health conditions. Additionally, we must maintain sufficient levels of testing supplies, have them ready and available for use, and provide testing results to patients in a timely manner. We must also consider and address the fatigue, anxiety, and depression that the staff will face when coping with patient deaths, long hours, exhaustion, and the stress that come from all of these factors. It is well known that the rate of suicide for healthcare workers is higher than that of the general population, thus emphasizing the importance of adequate mental health services for our staff. Other factors that must be addressed include excessive hours and shorter lengths of time between shifts due to insufficient staffing, while still ensuring that all patient care needs are met by providing the right care to the right patient at the right time. Additional concerns will originate from the limited amounts of equipment, such as hospital beds, ventilators, and personal protective equipment. There are multiple actions that must be taken to ensure that the patients receive the appropriate level of care without diminishing its quality or safety. It is vital to the organization and to the community we serve that steps are taken to endure this health crisis while maintaining the reliability and safety of the staff and care. Actions to be taken by myself and other leadership include collaboration with external organizations, allowing for non-COVID patients to be evenly dispersed throughout the available medical centers in the area. Non-ICU wards can be transitioned to accept ICU patients. We've already set up a tent outside, allowing us to screen and treat non-COVID patients. We've also established a nurse advice line, allowing patients that can be treated with over-the-counter medications to stay out of the ER and reduce their likelihood of contracting COVID. We have also assigned our ambulatory clinic staff, which are not currently treating patients due to closures, to be utilized in the tent outside, thus releasing the ER staff to care for more critically ill patients. By maintaining required levels of PPE, equipment, and medical supplies, the staff can focus on providing the highest level of care with reduced levels of stress and anxiety. And by further streamlining patient care, we can ensure appropriate allocation of staff and supplies, allowing us to fully utilize the resources available. Finally, by empowering the leadership, especially in the emergency room, through autonomy and awareness, workflows can be adjusted, treatment rooms can be repurposed, and admission processes can be modified as needed. I thank you for your time, and I will be followed by Harry and Hawthorne.
Good day, everyone. My name is Harriet Hawthorne. In this segment, Internal Constituents, I will be informing you of the factors affecting Elmhurst Hospital employees due to the outbreak of COVID-19 and the mitigation strategies required to achieve success during and after the pandemic. What went wrong? The following are factors that have to be addressed by the CEO for the organization to weather the pandemic. First, the hospital failed to enforce safety protocols, which resulted in employees contracting the virus. The facility's limited space prevented staff from establishing isolation rooms. Therefore, close quarters with patients, in combination with reusing masks and other personal protective equipment meant for single use, created the perfect environment for the virus to spread to staff members. Second, there was already a shortage of clinical staff before the pandemic, but fear of the virus, employees not feeling safe in their work environment, and employees contracting the virus exacerbated the situation. In short, The staff was overwhelmed with the number of patients requiring care. The immense amount of patients led to the medical staff being unprepared to provide care, which resulted in teams finding patients dead in their rooms. It was clear from the start that clinical teams were overwhelmed and could not manage or provide the quality care that patients deserve. In addition to being understaffed, the hospital also experienced critical shortages in multiple medications, protective equipment, and cleaning products. Finally, lack of direction, fear of the unknown, and having to make life or death decisions led to the deterioration of the mental and physical well-being of employees and the overall morale of the hospital. Why did things go wrong? Most of the challenges experienced could have been prevented or appropriately mitigated if the lessons learned from China were analyzed and used to formulate strategic plans. Poor planning and lack of communication with frontline employees was the instigating factor to most of the difficulties experienced by the staff. The way forward to achieve success. As hospital resources continue to be drained by infected individuals, decisive action needs to be taken to see the hospital through this health crisis to life after the pandemic. Success can be achieved if the CEO and the governing board focus their time and effort on improving 2 out of the 5 functions of clinical organizations, along with supporting service excellence. The first of the 2 functions is ensuring that all treatment and care is safe, effective, patient-centered, timely, efficient, and equitable. This means updating and maintaining protocols, maintaining logistic support, and ensuring patient and provider safety by minimizing risk. Second, improve clinical performance and population health. This has to be implemented as is through measuring and benchmarking clinical outcomes and processes that opportunities for improvement are identified and corrected. Finally, without clinical and logistic staff, the organization would fail. Therefore, it is crucial to support service excellence by providing associates with the resources they need. The following are potential disruptions to achieving success. Another extreme spike in infection rates that decimates hospital resources, manufacturers' inability to produce supplies and equipment fast enough, continued loss of workforce due to employees contracting the virus. Next is External Constituents by Dunette Moffett.
Greetings, everyone. My name is Dwanette Moffett. I will be going over external constituents and how the impact of COVID-19 affected how we conduct business as a healthcare organization, as well as a way forward to ensure business conducted is safe, efficient, and reliable. The COVID-19 pandemic has had a huge impact on how we as a healthcare organization do business. It has showed us that we must be prepared to adjust our current process and still meet the need of the population whom we serve. We have to remain cautious as things begin to open up and become normal. This will protect everyone in the organization. We must be able to do this while keeping everyone we serve and do business with in mind. Not being prepared for the influx of patients and equipment needed to care for them during such a critical time made it difficult for staff within the organization to provide proper care to their patients. The outbreak had a negative effect on vendors, patients, and community organizations. As a healthcare organization, you are to ensure the safety of your internal stakeholders as well as the external stakeholders. The outbreak definitely posed a risk, not only to employees within the organization, but to the patients and vendors supporting the overall mission of the healthcare organization. As we continue to move forward and begin to work around COVID-19, a few people to keep in mind are the vendors, patients, interns, students, community organizations, and funders. Being that our hospital provides care to low-income families, we need to also ensure that we implement a better system for national emergency preparedness for future pandemics as such. As you know, we were not prepared in caring for such a high number of patients at one given time. Vendors are the pharmaceutical, supply, and medical equipment reps. They are also contractors that provide services to the organization. They are much needed in the organization, but we want to keep them safe and reduce their exposure to the virus. Our CEO will meet with the governing board to ensure we have a plan of action in place to protect our vendors during such a critical time. This will be the same for patients, interns, students, and volunteers. We want to make sure that they still have a great experience while remaining safe. We will ensure we have enough medical supplies to provide our patients, vendors, and volunteers so that they can fulfill their obligation to our healthcare organization. With community partners, we will need to ensure their safety by monitoring patients closely when referrals are made for things such as rehab, hospice, or long-term care. When signs or symptoms of COVID-19 are present, it may be best to continue to treat them here at the hospital to minimize exposure and outbreak within the community. In all this, we must be diligent in verifying insurance information and submitting claims timely. Due to COVID-19, there has been a reduction in the workforce, and we must account for this on both ends. Moving forward, it will be important to address challenges early on, especially when it comes to patient access, supplies, and billing. We will want to be sure that there is no delay in care. As an organization, we will continue to monitor state and local government recommendations and make adjustments as need be. To define success, we will monitor the hospital-acquired infections to ensure no outbreaks occur. We will monitor the billing processes, continue to monitor satisfaction reports, as well as encounters and appointment availabilities. The apocalyptic ordeal all staff experienced at Elmhurst Hospital in Queens, New York, when it became the epicenter of the COVID-19 outbreak in the United States, will certainly change their lives forever, especially to the ones called the 700 team. The 700 team consisted of staff whose responsibility was to respond to cardiac arrest patients on the verge of death caused by the virus. After the pandemic is over, the public's perspective and appreciation of the work of healthcare professionals will perpetually be different in a positive way, considering a few factors. One, when a vaccine is discovered and made available to the public, improvements in infrastructure and scientific data produces better forecasting tools, and lastly but not least, the revision of public health protocols are implemented within the facility. The leadership at Elmhurst Hospital currently faces and will continue to face many challenges in the future. With implementations of 4 of 5 functions of cultural leadership, the establishment and enforcement of an ethical culture, and with the smart utilization of the powerful influence constituent groups exert on legislators, communities, medical staff, and drug manufacturers. The vision and mission of the organization will become shared goals, and there will be collective enthusiasm in all stakeholders. In the end, we must not forget that the main reason HCOs exist is to ensure that the delivery of care is safe, effective, patient-centered, timely, efficient, and equitable for the communities they serve.